All right, welcome back everyone to the industry's first conference focused exclusively on dental reprocessing. To say I'm excited about this next guest is, again, an understatement because Johanne is an agent of change, here to change the narrative of reprocessing in the dental industry through implementation of best practice. Johanne has a Bachelor of Science in Business Management with a concentration in human resources. She's a certified sterile processing technician, a certified healthcare leader, a member of ISHM, also a member of OSAP, and a certificate holder in dental infection prevention and control from OSAP and the Dale Foundation. She is a treat, and I'm so excited for her discussion today on how dental professionals can ensure that a reusable medical device is safe for use from patient to patient, and that is no easy task, as we've learned a lot about today. So without further ado, I am going to introduce you all to Johanne Benoit.
Thank you so much, Lindsay. What a great introduction. Thank you everyone who is attending or will probably be attending later on. I know it's probably right after lunch. And so I want to be able to hope that my presentation provokes a lot of thought, provokes a lot of questions. So please be sure to have this be as interactive as possible. So let's get into what I call the nitty gritty. I called this presentation the nitty gritty because I wanted to be able to give or provide insight on how much it actually takes to take an instrumentation like a dental handpiece and take it all the way through reprocessing. And without further ado, let's get right into it. So the objectives are just the things that I want you to be able to get out of my presentation. What a handpiece is and what its purpose is, why are handpieces considered semi-critical devices, what an IFU is, where does reprocessing start, difference between manual and automated reprocessing, why reprocessing requires the right tools and equipment, what are IFU curveballs, that's kind of what I call them, and then lastly, why chairside cooling needs to stop. So here is a picture or several images of a dental handpiece. By definition, a dental handpiece is a handheld device used to perform a variety of common dental procedures. Common dental procedures like removing decay. We're talking about polishing fillings. Altering prostheses. Utilized for cosmetic dentistry. The handpiece is the most utilized tool, within dentistry. Without it, you can't do your job. And so as a reprocessor, this was something that I really had to get to know. I totally always refer to the handpiece as being as important as a scalpel is to a surgeon. Flour is to a baker. There are certain things that without it, you can't do the things that you are called to do. So if you're in dentistry, if you're a dental healthcare, provider, you need a handpiece. The handpiece is like your critical tool. So when it comes to the handpiece, we talked about its definition. We are going to get into Spalding Classification, which really lets us know, okay, well, where does the handpiece fall in? So the handpiece is considered semi-critical so that we know that it is best practice recommended that it is heat sterilized, okay? But the burr that actually goes into a handpiece is considered critical. So it's very important that Spalding Classification is something that is always referenced and referred to when it comes to trying to figure out, okay, I've got this device, where do I go from here? How do I equip myself with the information that I need so I know how to take it through reprocessing? So this is an IFU. The IFU stands for Instructions for Use. In dentistry, in the dental industry, it's often referred to as a DFU, Directions for Use. Either way, it's where the step-by-step instructions are provided by the manufacturer are found, okay? Sometimes they're in these little, wrapped up what would I call them, pieces of paper inside of the items that you've purchased. They could be found inside of a manual, sometimes on the manufacturer's website. Maybe that's where they will, point you and say, if you need the instructions, you need to go there to find it. It's usually tossed out and not really paid attention to, but it's actually the blueprint of everything. Well, not everything, but it's going to be like the main place where you're going to need to find out the information the manufacturer is trying to give to you. The IFU on there, you're going to find information about what you can use on there, what you can't use on there, how to use it, how long. It'll tell you if it's a single-use device. There is a lot of information found within the IFU. So this should be your go-to thing. If you're ordering a device, if you're thinking about getting a device of any kind, even a handpiece, you have to get into the habit of requesting that IFU, because the IFU is going to show you everything that you're going to need to know. So we're going into our first polling question. Has anyone ever read an IFU? So, I'd love to have everyone give your honest opinion. If you've never heard about it, if this is your first time hearing about it, if you've ever read it, if you've actually tossed it in the trash, be as honest and answer this question. Wow. So the numbers are in, and a lot of people have actually read an IFU. And so, which is very good, because this would be the first step in patient safety, is knowing what the manufacturer actually wants you to do with that specific device. So we're going to continue. And so by definition, the IFU, the instructions for use, a form of, labeling, which was created, to be able to provide us or the patients or the people who are planning to utilize these devices with information. Information is always good. It may be tedious at times to go through that information, but you will be surprised once you get into the habit of actually looking into these IFUs, the amount of information you'll be able to find out of there. One of the great things I love about IFUs is that it is not an easy read, to say the least. I won't lie to you. It's not an easy read, but a necessary one. So let's move on. Here, I place this to let you know that the IFU really reprocessing starts within the operatory. The reason why I say that is because many IFUs, and we're going to go into this, you will see that the IFU will have statements such as, remove the handpiece from the coupler. Where's the coupler found? It'll say, remove the burr. That's usually found in the operatory. Remove the prophy angle, remove the attachment, remove the disc, remove the U-style angle, remove the cooling tube, remove the spray clip, flush for 20 to 30 seconds. All of these statements are found in IFUs, which leads us to believe that the reprocessing step starts with you within the operatory. But you don't have to take my word for it. If you look at this image right in the middle, you'll see this is a snippet from a dental handpiece IFU. And it says, operate the handpiece at chairside for at least 20 seconds to purge fluids in the handpiece. This IFU actually requires this to be a step that happens in the operatory. They're asking for you to do that. You wouldn't have ever known that it's being requested of you if you've never read the IFU. Now, This excerpt is the next excerpt that's with the highlighted section is taken straight from the CDC guidance, which, let's see, it says, any dental device connected to the dental air water system that enters the patient's mouth should be run and discharge water, air, or a combination for a minimum of 20 to 30 seconds after each patient. So along with your guidance and the IFU, you have a mandate as to certain steps that need to be taken in order to continue with your patient safety, to stay within your patient safety, what's the word that I'm kind of looking for? You want to always, always have the patient safety in mind. So that's basically what I'm trying to get you to see, is that your guidances and the IFUs actually helped you to keep the patient safe. But if you're unknowledgeable of it, how much safety or how much of it are you keeping in mind when it comes to patient safety? Is that really in the forefront of your mind, or is it in the back? It's really important for us to break these habits or break these cycles where we're thinking, oh, you know, I've got it. Maybe you don't have it. And if you want to know how you can actually say that you do got it, you've got to start reading these guidances. So here is an excerpt from, let's see, this particular handpiece. What you can see here is that the manufacturer has done a very good job of not only providing the wording description, they've also taken an extra steps in order to provide visuals. So they're, you know, taking you through the step before the handpiece even actually goes to what you would call your steri. Before it even goes there, they are telling you what the steps you need to do. You know, removing the burr, actually wiping down the exterior of the handpiece. It's also telling you to flush it for 20 to 30 seconds, you know, removing the handpiece from the coupler. All of these things are being, you know, informed to you as steps that need to be taken in the operatory before it actually goes to get additional reprocessing. So if you can see here, the manufacturer also in bold and in yellow says, don't immerse this, you know, in any kind of disinfectant solution or clean in an ultrasonic. So my key thing is not all devices can go into the ultrasonic. The IFU will tell you that. It will let you know what, you know, the limitations of your device, what it can do, what it can't do, what you should do, and what you should not do. So here is another example of point of use steps to be done chairside. This is another excerpt from another handpiece, IFU, and here it is noting that you clean the medical device immediately after treatment. Okay, flush out the liquids. And we're talking about your OPIM. We're talking about blood. We're talking about saliva. It's very important that, you know, these steps are taken, and time is of the essence. It is the most challenging thing is to have, you know, bioburden hardened, and by the time it's, you know, inside of the steri and it comes to, and it needs to be additionally reprocessed, and you're spending a lot of time to even try to take it off. So, you know, point of use is very critical in the life and prolonging the life of your instruments as well. So after you have completed your point of use, you know, steps, and your handpiece is ready to go into steri, it's very important that you know how instruments are supposed to be transported. Now, you can always still reference the OSHA guidelines to that as well. But this little excerpt here within your CDC guidelines also, provides guidance on how to carefully handle and transport instrumentation from your operatory, to your sterilization area. So what the excerpt states is that dental healthcare professionals can be exposed to microorganisms or contaminated instruments and devices through percutaneous injury, contact with non-intact skin on the hands, or contact with mucous membranes of the eyes, nose, or the mouth. Contaminated instruments should be handled carefully to prevent exposure to sharp instruments and can cause percutaneous injury. Instruments should be placed in an appropriate container at the point of use to prevent percutaneous injuries during transport to the instrument processing area. So I believe, as our presenters before me have stated, it's important for you to have a leak-proof sealed container that you are transporting your instruments through. It also needs to be puncture resistant as well, and locking. It also does need to be labeled. And when you are transporting your instruments within that container, it's very important how you carry it. When it actually is labeled with a biohazard sign, it's a visual indicator to your coworkers and also to patients if the flow of travel from the operatory to the sterilization room, you're going to be also in close proximity to other people. It's important that you are holding your transportation tray parallel to the floor. It's a visual indicator that biohazardous material is being transported. A lot of these things are necessary precaution measures that are taken, not only to keep you safe, but to keep your coworkers or the staff safe as well. So the next step we want to talk about is disassembling. Now, disassembling handpieces, it all depends on the complexity of the handpiece. Here you will see, I think I have shown three. I've shown three different handpieces who right inside of the IFU, it requires for the handpiece to be disassembled. The first one here on the far left, this handpiece disassembles into three components. The one in the middle actually has cooling, cooling tubes, a Y manifold that should also be disassembled. I believe that this one, if it depends on which version or brand that you have, some of the handpiece itself would come apart, but for this particular one, it was solid all the way through. And the last one, when it would, the IFU is stating that the keypad needs to be removed, disassembled from the handpiece prior to commencing reprocessing. So, when it comes to reprocessing, you've got options. I say you have options because the IFU will provide you with instructions on how to reprocess a handpiece manually or automated, or a combination of the two. Now, I say a combination of the two because you will see in the later slides how you may have to revert back and forth almost between the steps in order to accurately reprocess a particular handpiece. So manual reprocessing, you'll see these excerpts or images are actually taken straight from IFUs of these handpieces. You'll see the description where, there is a sponge being used to clean off the handpiece, a cotton swab to get into, not fully into the inner of the handpiece, but that's also a requirement. A wire brush, let's see, lubrication spray, lubrication oil. The IFU is indicating and pointing as to where these focal points need to be and all the areas that need to be addressed when reprocessing the particular handpiece. and automated reprocessing. Here I have a picture on the far left corner of an ultrasonic. I have another picture of a washer disinfector. I have pictures of washer disinfectors that have the capability to also clean the internal mechanisms of your handpiece. Through thermal disinfection, and they have different attachment pieces too. So, you know, depending on what the IFU is calling for, you know, you're going to have the right kind of equipment in order to reprocess the handpiece. So there's also automated internal cleaning and lubrication. This can happen with a machine, or you can have it be done manually as well. So here is an excerpt from an IFU where it is telling you to run the handpiece until it reaches a normal speed, or until all excess lubricant is expelled at a minimum of 20 seconds. Expel in the operatory or using one of these automated systems here. The whole purpose of this is to actually get lubrication into the inner workings of your handpiece. You want your handpiece to be fully functioning. You don't want your handpieces to be jamming up. So this is a key step in figuring out whether or not you want to have this be an automated or a manual process is something that, after reading the IFU, you will have to come up with a protocol or a procedure. So I want to kind of get into this because this was a game changer for me, and it's important that when reading the IFU, you take any questions that you have and communicate your questions to that manufacturer. So this is an excerpt from a handpiece, which I believe, let's see, I think it says here, it is asking also light lubrication of your coupler and O-rings. So this also was kind of like an indicator to the dental healthcare practitioners within the practice to know that it's not only the handpiece that does need maintenance as well. Couplers need maintenance. So, you know, it is important, you know, to look at these things. There are arrows that are pointing to I think it's like fiber optic, you know, things, and special attention that needs to be placed to those areas as well in your handpieces. So it's important. So here, there is talking about cleaning water spray holes. And I remember seeing a handpiece and seeing these holes. And as a reprocessor, we know when, you know, an item has lumens, then there has to be some way that we are going to be able to get into, you know, these holes. And so here it says that run the cleaning wire supplied with your handpiece back and forth in the water spray holes and in that area and in that air spray hole to loosen and remove mineral buildup at spray surface. Okay, so this was critical to me because in the practice where I looked everywhere for this brush that was stated inside of the IFU, looked everywhere. We didn't have it. It was tossed out along with the box that it came in. It's a common thing not to pay attention to the IFUs or additional things that come in with it if you don't know its importance. The IFU is going to tell you that. So I actually called the manufacturer and stated, this wire brush, I need it, and I'd like for you to mail that to me. I think the first initial question from a customer service representative was, you don't have the box, or let's figure out how to get that to you. It took a few people to be able to get that wire brush, but it is important that that should be something that is ordered on a continual basis if your IFU is requiring for you to get into those ports. So the real question is, do you have a handpiece that does have these holes, and do you have a wire brush? If you don't, today, you will know that you can call the manufacturer and request it. From here on out, you can actually make a difference and change how the handpiece is being reprocessed, should the IFU require for the holes to, for you to have that wire brush. So, you know, when it comes to figuring all of this out, it's not an easy task, but it is a task that is achievable. So, you know, with that said, it's important for us to keep in mind that technology is always evolving, and the instruments that we are known and used to now will look very much different 10 years from now. So we are going to really greatly rely on the manufacturer provided information to lead us and guide us into the directions that we need to go in order to keep the patient safe. So I want you to take a look at these next clips. They're actual clips of placing that little tiny wire brush into these ports that are being displayed here and in the excerpt of this IFU. It was not an easy task. As the wire brush was being placed into those holes, it would jump back because there was so much mineral buildup and clogging within these portholes. And if you look closely, these portholes in this handpiece, they had 8 holes, and the inner ones were smaller than the outer ones. So it is something that the reprocessing of this handpiece does not happen as fast because it requires so much attention to detail. So here you're going to see the images of the wire brush when your handpiece actually goes through this series, it goes through a lot of steps, and it's not something where the turnaround happens very quickly. It's something that you do need to take the time to get to know the process, understand each handpiece, and you know, properly train and inform your staff based off the IFU on what needs to be done to properly reprocess it. A patient is going to be on the other end of this handpiece, and it's always my belief that that patient could be me. That patient could be a mom or dad or a family member of some sort. And the level of care that I would like for myself, I need to extend that same level of care to another person. So it's important for us to really get to know your handpieces, get to know these devices, read these IFUs, and follow the guidelines. So different handpieces require different tools. Okay. 2 different excerpts from Handpiece IFUs. One stating the use of an ultrasonic, and the other stating the need for 3 different other tools or items: demineralized water, compressed air, and thermal washer disinfector. 2 IFUs, 4 different tools or items that are needed to reprocess it. Now, if you look into the one that says weekly maintenance on a weekly basis for for a handpiece. It's asking you to ultrasonically clean it for 10 minutes. Okay, and this excerpt is coming from after disassembling the head of a contra angle. It is asking on a weekly basis that the head is placed into an ultrasonic for 10 minutes. Okay, this manufacturer IFU actually even tells you the length of time it's supposed to stay within the ultrasonic. The second excerpt is asking that the handpiece be rinsed with demineralized water. So not just tap water, it's saying that you need demineralized water for that IFU. In order to completely dry this handpiece, compressed air is asked to be utilized. Compressed air is not something that's normally found inside of your sterilization area. So again, it points to before you actually place an order for a particular handpiece or a dental device, you've got to read that IFU. Ask your reps for that IFU and read it thoroughly so that you will have the equipment that you need in order to reprocess it. This particular handpiece also asks and requests for a thermal washer disinfector. As our previous presenters have said, different practices, private practices, it may just be a luxury to even have a washer, an instrument washer, but to have an instrument washer disinfector is a whole different level. And it's important for us to know that the IFU is going to drive, what your sterilization area is going to look like, because it's going to require for you to have the necessary tools. So I say follow the IFU road. Why do I say that? Because if you take a look at just the IFU that says that the contra angle needs to go into the ultrasonic for 10 minutes, well, how are you going to put it into the ultrasonic? That's a good question. You want to be able to manage properly, take the little pieces and bring them all the way through safely through reprocessing. So one tool that was utilized is to place the little contra angle head inside of a small case. Well, that small case has its own IFU. Yes, the product manufacturer of the case that you place it in has its own IFU, and that IFU then tells you, hey, if you're going to reprocess anything in our little case, you need to reprocess it for this amount of time. If you're going to place it inside of an ultrasonic, it needs to go in that time. But then the IFU for the contra angle head told you it needs to go in for 10 minutes. What do you do when the IFU then says, hey, if you put it in this little container, it needs to go in for that time as well? Then think about this. The ultrasonic itself has its own IFU. The ultrasonics IFU is going to give you information on the solution that can be used within there, how often to change it, how often you can the times that you can put your instruments in, and then think about the solution that goes into your ultrasonic. That solution has its own IFU. Yes, there are IFUs for almost everything has an IFU. And getting to understand this process, the unique balances and control measures and times and temperatures of all of these IFUs goes into reprocessing. It goes into these devices. It's not just, get it in there and get it out. It's figuring out, well, what process are we going to develop in order to, follow this line and stay in line with all of these instructions that are being given to us. So, does your facility have all the tools and resources to follow the IFU? This is our next poll question. So the results are in, and it looks as though, okay, there are some places that don't have all the tools that are, being required by the IFU, which is okay. This can just be the starting point where you can take this information that you're learning today and start to make changes. So what I did when I was going through just different IFUs for different hand pieces, I counted 14 tools or equipments that the IFUs are saying that are needed in order to properly reprocess these IFUs. And to properly reprocess these hand pieces. And this is before we're even talking about the PPE that needs to be worn by the staff who is reprocessing them, and that's considered equipment too. So it's very important that you're taking the time to dissect your IFU and to, make lists of exactly what's needed in order to do the reprocessing correctly. So why am I saying all of this? Have you ever had a handpiece lock or have the burr jam and can't come out? Have you ever had a handpiece lose its function? A handpiece that is so discolored, like you have looked at it and said, I know something's wrong with this handpiece. It didn't look like that. When you take the time to actually reprocess according to the IFU, you're taking the time to reduce, cost for repairs. You're taking the time, you're taking the time to reduce your cost for replacement, and you're also, dramatically reducing the time that it takes for you to, have to not use a handpiece and need to go and find another handpiece that you can utilize. Prevention is key. So don't be alarmed. It's very important for us to really take a look at our processes. This next slide shows hand pieces that were not, in the internal mechanisms of the hand pieces were not being properly cleaned. And so through cycles and cycles and cycles of reprocessing, this was like a buildup of a lot of things inside of the hand pieces, which were not making the hand pieces work as effectively as they could. A change that was made within our reprocessing, our SPD, is that a whole different machine was purchased in order for us to be able to clean the inner workings. What you're looking at is the IFU for this automated machine stated that what would happen is that there was a cleaning and lubricant not chemical, it was a product that was used that would flush through the inner mechanicals of your handpiece, and it was required that the handpiece would have to go through until it expelled no discoloration. We had handpieces going into that machine and opening it up and seeing all of this sludge and like buildup, from reprocessing it improperly. It's scary to see it, but it's also refreshing to know that once you know that there's a problem, it is your obligation to fix it. It is your obligation to pick up a phone and call and, talk to your colleagues or call, other people and say, hey, are you finding a problem with this? It is your obligation to hop on the internet and find people that can actually, provide you with guidance as to how to make it right. So there is something that I did find that was missing in the reprocessing steps, and that is inspection. Inspection is key. As you can see, inspection is required as a guidance. Is a guidance within your CDC, and it's also inside of your IFUs, and it will tell you exactly what it is that you're going to need to inspect. Visual inspection for damage, visual, inspection. Let's see here. This excerpt from Handpiece says that visual inspection of internal components and electrical boards on suspension and safety interference, function test, is the handpiece being ran, to see is it functioning, properly, and will, if there are issues that are identified at inspection, then this handpiece cannot go back out to be utilized on a patient. A preventative maintenance plan, program would need to be developed where those handpieces will then get sent out and go and get repaired so that they can come back and after being repaired so that they can come back and go back out into circulation. Inspection is key. If you do not have the inspection part, in reprocessing, you do need to incorporate that. You will find that your IFUs will have an inspection portion on there. Limitations for reprocessing. So your IFU will provide you with that information. So if you have components of your handpiece or your device that have a life, or the manufacturer is going to tell you, these are how many times you can reprocess it. After these many times, you've got to get rid of it and you need to get a new one. In this excerpt for this particular handpiece, the manufacturer recommends regular servicing of that handpiece after 500 processing cycles or a year, whichever one of them comes first. So if you're a very busy practice and that particular handpiece is being used, you have to develop a tracking system, in order to meet this. Requirement from the manufacturer. There's a recommendation here to replace the Y manifold after 50 processing cycles. Another one for the spray clips after 100 processing cycles. It's important to understand that there are some devices that are not created to last forever. The IFU will let you know that beforehand. This way, when you are making a decision to purchase a device like a handpiece, you will have a more informative decision. You will be able to budget your costs knowing this information, so that you can be able to purchase, items that are that you're not going to be surprised when you find out this information because you didn't do the due diligence of reading the IFU beforehand. So preparation for sterilization. One of the things I wanted to point out is that if the IFU is deficient in guidance of infection prevention and control, your guidance for infection prevention and control is sufficient. So if you look at these excerpts here, it'll just say bag and autoclave. Insert the handpiece in a sterilization bag and load into an autoclave. Wrap the contra-angle handpiece and keypad in sterile bags packaging. The IFU just simply says, hey, after inspection, you're going to just take this handpiece and place it, within a sterilization bag. But what it does not say is that you do need to have a chemical indicator within it. This is where your guidance comes in. This is where your infection control, prevention and control guidances come into play. It is important for us to get so familiar with these things so that we know that a chemical indicator has to be placed on the inside. Of any sterilization, pouch, anything that you're about to sterilize, you need to have a chemical integrator, placed within it. AAMI ST79 does state that you need to have a class 5 chemical integrator or higher. It's just important for, dental healthcare practitioners to stay abreast on the latest studies and the guidances that are coming out when it comes to steam sterilization, because we have come light years, from the 2003 guidance. And if you're still utilizing that guidance, you do need to, take the time to constantly, review it, and then also try to incorporate, the latest guidances when it comes to that, because it's really will increase your level of patient safety standards. So in this photo, you will see hand pieces that have been placed in peel pouches that that are proper for their proper sizing for them, because that's important. And inside of each and every single one of them, you will see a class 5 chemical integrator. Okay, and I just wanted to point out that the class 5, measures temperature, time, and steam. And steam penetration. So what's happening to that instrument on the inside? Was the steam in the autoclave, sufficient enough, to kill the microorganisms? This information we find with biological testing, but the reason why it's important to put indicator on the inside of that pouch is because inside is what matters. What happened to we're not inside the sterilizer to see what's going on, but the chemical integrator can tell us, hey, this is what happened. And it can be an indicator, a visual indicator to us to let us know that if there was something missing within that process, we would need to reprocess again. So the picture on the left will show you, a handpiece that was, bagged inside of a pouch that was too small for it, and a pouch that was way too big for it. It's important to know that air acts as a barrier to steam, and you need to make sure that your peel pouches are sealed, are properly sealed, so that air is not a barrier to that, okay? I don't call these this is wrong or this is right. What I do call them are opportunities to make a change once you are informed of how to properly reprocess. Okay. In the picture on the left, you will see that there's a lot of writing on the paper side of the pouch. And as a certified, sterile processing technician, it's important. We have learned that that writing happens on the plastic side and not the paper side. There are more studies that have, come out that talk about about the ink. Patients may have allergic reactions to the ink that may during the sterilization cycle kind of bleed into that pouch. So this is, a reason why writing, should happen on the plastic side as opposed to the paper side. So there are a lot of information that is out there. As healthcare providers, it is our duty to stay abreast with this information, to call out things in our practices or the places that we work, because a life is at stake. And so it's important for us to just, constantly be evolving and learning. So when it comes to making sure after you've done your inspection, you've, properly placed your hand pieces within an appropriate sized pouch, then your hand piece is ready to go into the sterilizer. These are excerpts from many different Handpiece IFUs with all sorts of different sterilization times. I want to say that it can't just be put it inside that autoclave and hit a button. You can see there are times, depending on what kind of sterilizer that you're using, there are times for a gravity displacement. There are times for a pre-vacuum sterilizer. It's important to read the IFU so you can know what time to set your autoclave to, so that your handpiece is sterilized according to what the manufacturer's recommendations are. So I say when you're reading the IFUs, it's important because you want to be able to develop a good program, for the staff who are going to be reprocessing. Some IFUs, and here are some excerpts that I have placed here, you'll see that it will require the user to convert the temperatures from Celsius to Fahrenheit. There are also some that will require for the user, maximum or minimum temperatures. It can be confusing to anyone who's reading that. There also is here an excerpt where the IFU then says there are instructions for this particular handpiece. Sterilize it alone. You can't put anything else inside of that sterilizer with that handpiece. Okay, so these are what I call curveballs that an IFU will throw, at anyone responsible to reprocess, if they are not familiar with reading an IFU and understanding these things, these will throw curveballs. And if people are confused, then you will make mistakes. So it's important to let's read these IFUs and come up with a procedure and protocol, for your facility or for your practice so that we can limit, these curveballs and that our reprocessors are equipped to know what to do in these situations. So again, you could be confused. Well, what kind of sterilizer is needed to be used? There are so many different types, so it's important. I've read IFUs that just say Class B. That could mean, that means a lot to us as sterile processing technicians, but to a dental healthcare practitioner, Class B, you're sitting there boggled, your mind is boggled, you don't know about these things. So it's important to, read that IFU and figure out, well, what kind of sterilizer do I have so I can know at what time and temperature to set the autoclave to. So when you're going to prepare your pouches to be placed within the sterilizer, it's important that you also provide means for your pouches to have adequate spacing. And also you want to limit wet packs. You don't want to open up your sterilizer and see that all of your packs are wet, because that is an indicator that you have to reprocess everything. So one key thing that was a change is that the sterilizer company actually makes racks, and you can place your hand pieces inside of these racks so that they allow drainage of the water vapor, and it worked way better than the trays, because there were times where you could find water or condensation on top of your peel pouches when the cycle is finished. So that's also important to be able to work along with your sterilizer manufacturer if you are seeing things like wet packs, to figure out how placement, can be made. Sterilizers have maximum weights, and you do also need to understand that it's a process, and you have to develop it, based on the equipment that you have. Dental hand pieces, pre and post sterilization. So the feel and the look of a peel pouch before it goes into a sterilizer is totally different than when it comes out. So it's also important that the chemical indicators are on the inside, because they are your visual cues on what that they have gone, or they have been exposed to time, temperature, and steam penetration. So now we come to our last question. And it's, how often are devices cooled down chairside at your facility? So I wanted to make sure that my presentation hit this. This was something that was very new to me, and I could never quite understand it. So chairside cooling, The practice is very busy, the patient's in the chair, and we need to have the instrument now. We need it. There's this urgency. We need to have it now. So handpiece could be taken straight from the sterilizer, opened right up, and then placed underneath running water in order to cool it down so that it can be used. Now, how is that safe for the patient? I'll reiterate it again. The handpiece is hot. It's taken, ripped open from the peel pouch, placed underneath water to cool it down. How is that safe for the patient? It isn't. It's a practice that the only thing I can say, it really boggles my mind, because if you're asking that question to yourself, how is that safe for the patient? It isn't. The handpiece needs to cool down. Just by touching it hot, wicking happens. And you will see here in the middle is from the CDC guidance that says packs should not be touched until they are cool and dry, because hot packs act as wick and absorbing moisture and hence bacteria from the hands. Not to mention placing it underneath water, which just allows, for microorganisms to come in to then have a means to be on the handpiece. Chairside cooling should never occur. If this is happening in your facility, then you do have to totally revamp. And ask yourself the question, do you have the right amount of hand pieces, that you need in order to see all of the patients so that you don't have to do this? What are the reasons that this is, happening? And come up with a solution. It's not going to be easy. I was a part of changing this in the facility that I worked in. And it's really about educating your staff about how to keep the patient safe. Chairside cooling is definitely something that you are posing a great risk to your patients, and it does need to stop. So instituting areas where you can place your hand pieces to cool down until they've reached room temperature, putting up signage that, says that, do not touch, that these instruments are being cooled, increasing the amount of hand pieces needed in order to meet the demand, were some of the things that we did in our facility in order to not have chairside cooling occur. So this is basically almost all, and not really going too into depth of what it takes to reprocess a handpiece. Preparing it, arranging it in a manner to facilitate sterilization based on what sterilizers is being used. Check the times, okay? That's important. Loading the sterilizer properly is also important. Setting the time and temperature once the sterilizer, the cycle is done. And I will say it again, once the sterilizer cycle is done, it's the hand pieces of devices are allowed to cool down inside of that sterilizer prior to them then going to the cooling down area to be placed within their storage locations. So even the IFU will tell you what your storage location will need, what requirements it will need to meet. Clean, be dust free, be dry, in a cool room, and your pouches need to remain sealed until they're required for use. Your IFU, this information's coming straight from your IFU about what your storage area is supposed to look like or how it's supposed to be maintained. So here are some, pictures of how handpieces are placed at a facility. As they are coming off of the cool rack, we would place the newly sterilized handpieces in the back and move the previous ones in the front so that we could make sure that there's a continual system of them being taken out for use as they come in. So maintaining sterility is also very important because if it has punctures, tears, holes, that means that your device it's not safe for use. That you can't use it on the patient once it's been opened. Okay, so this is something that before you use any sterilized device, you have to check it. This is your job. In order to keep the patient safe, you have to check it for its integrity. So in conclusion, and I want to just try to get in some time to answer any questions, the IFUs plus your guidances and all your healthcare professionals, if you are utilizing this formula in the manner that it's intended to, will lead you towards patient safety and better patient outcomes. Thank you.
All right, Lucy, I'm sorry, Johanne. Thank you so much for providing that information. Lucy is coming up next, but I know we're at time, but there are some really important questions that I would love to kind of do a rapid fire with you, if you don't mind, because I think that your insights, your knowledge are the perfect things to address these specific questions. So the first question that I have for you is it okay to use a peel pack with an attached indicator to the peel pack if the indicator is reflecting as internal and not use an additional class 5 indicator inside the package?
So if I understand this question correctly, it's the indicators that come on the outside of the peel pouch that whoever is posing this question is talking about. So the CDC guidance, states that you do need to have a chemical indicator on the inside. The outside is just not enough. Understand that the indicator on the outside is just a visual that it's and there I think it's considered a class 1, I believe, and it's just considered a visual that it's only been exposed to steam. I have been there where a sterilizer, yes, revved up, starts to go and malfunctions. That indicator on that pouch, of course, will change from the brown, from the pink to the brown, but the cycle didn't go through. Something happened, and that indicator on the outside of the pouch, yeah, it turned. Yes, steam, it got to steam, but it didn't get to the sterilization phase.
Okay, great. There are actually a couple of questions that came through. Is the type 5 necessary for peel pouch, being that the pouch has the color changes on the outside? So thank you for addressing that question. This next one that came through is it okay to use a peel pack? Oh, sorry, I just did that one. This one says, how do we know what disinfectant wipe we can use if the IFU does not state the specific one?
That is great. This was a great question. Some IFUs won't state what kind of disinfectant wipe. This is the time where you actually talk to your representative, the product representative, and reach out to them and ask that question. You can ask them, does the manufacturer recommend something? Like, what has been utilized? Something had to be utilized for them to place it inside of the IFU. So if it's written in there for you to use it, in order for them to write it down and place it in there, they had to utilize something. So some manufacturers will tell you, oh, we don't recommend a specific brand, or, we don't want to promote one brand over another, but something was utilized. So you could even go and also ask, well, if you can't recommend, a specific brand or something, like, what are the ingredients my disinfectant needs to have, in order to meet, to meet this requirement that you're saying. So it's important to, to have that constant communication with your reps, with your manufacturers, so that, you can get a better understanding and then, to meet these requirements.
All right. Joanne, this next question, are all handpieces created equal, as in is one IFU the same for all?
They're not. Nope. As the handpieces get more complex, each and every single one of them requires, different attention to detail and different steps. Wow, I think in the facility I worked in, we had like 7 different handpieces, and none of the IFUs looked like one another.
Okay. Do you think that dental techs should be certified sterile processing techs as well?
I do believe that this is something that's missing within the dental industry, and could very much, elevate dental technicians to have that additional certification, because you can revolutionize your patient safety, if you do have that certification. If this is something that you're considering, I say go for it, because it will open your eyes to a lot of things. I actually, have seen that happen, a dental assistant transition and become a sterile processing technician.
Okay, great. And I'm going to leave with this question. I love the phrase that you said, once you know there's a problem, it is your obligation to fix it. How did you find your voice to speak up and start making change in your dental work environment, and what challenges did you face?
I did face a lot of challenges. I'm going to tell you that it's not easy. For me, this is my passion, and I do believe that if you are in healthcare, this may be a question that you do need to ask yourself. Like, why did you choose healthcare? You could have chosen anything. You could have chosen to be anything. But deep down inside, you wanted to be able to help patients. You wanted to be able to help people. So if you're not waking up every day with that same fire, with that same energy, you may need to ask yourself, well, why am I here? We can't have a job if we don't have patients. We can't help anyone if there isn't anyone to help. We want to be there to provide assurance to them, and not be there to do anything else. Our patients trust us. They are depending on us. So this is why it's our obligation. In speaking with my friends or family members, when I have conversations with them, many of them say it's just assumed. Like, when patients come in, they're like, you've got it. Their trust is totally in you. So that brings you to a whole nother level of obligation, where someone is, they don't even know you, but they know that you've got them. And that's big. If someone says, I've got you, I'm going to believe, hey, if they say I've got you, that they've got you. And so if you're not at that level yet, it's important for you to start to think about that and ways that you can elevate that. There's a lot of conversation that happens around changing. It does start with policy and protocols and providing that information, doing research and, showing what the studies, are saying. You can Google and, just see like things that are happening within the dental industry, patients who have, inquired, infections. You wouldn't want that to be you or a loved one. What can you do right here, right now, today to prevent that? Our dental healthcare practitioners who are licensed, why would you want to jeopardize your license? You've worked so hard. We've all worked so hard to get here. And it could be gone just like that. So it's important for us to constantly be keeping that in mind. We wouldn't be here without the patient. So why wouldn't the patient be on the forefront of our minds?
I love that. Johanne, thank you so much. We did have more questions that came through, but unfortunately we're out of time. So I'll make sure that those questions get sent to Johanne so that she can address them directly with those who ask them. Thank you for sharing your passion. We needed this burst of energy, this burst of passion, and this information today. And so I'm so thankful to you. If anyone's interested in listening to Johanne's interview on the Beyond Clean podcast, you can actually find that in the list of resources on your page on the right-hand side in your resource list. So So give it a listen. Definitely follow Johanne on social media. She's a rock star on LinkedIn. It's awesome to see the information, the educational posts that she puts out. So Johanne, thank you. From all of us at Beyond Clean, thanks for being a part of this today. And for everyone who's tuned in, we will begin the next session in about 6 minutes. So we'll see you all in the next session. Thanks for joining us.